Berlin, chez comment il est? Bonsoir, bonsoir le peuple. Oh, bonsoir mes amours, comment nous est? Voilà de ça, mon village de Diodi. Il t'a pas au conseil pour pas venir dans la boue. Et puis voilà, c'était après ramasser dans la boue. Et puis même pour nous venir ramasser tout. Je ne sais pas acheter travail, nous faire bonne sang, bonne business sale. Je fais acheter travail pour nous faire. Et je prétends n'importe qui vient en face. Je ne sais pas qui nous est. Je vais publier une série de bagages sur nous. Ok, pas oublier pour moun qui apprend review avec moi. Mais si on fatigue avant. On va faire que moun confiance la communauté. T'as pour moun la boule de faire review là, sortant via la venir voir les business. Si 631 708 21 21 pour relève pour review. Yo mon Dieu, oh my God. Ou même qui t'a assuré place le Pierre nous l'école là ouvert. Ou aller pour payer un good. Ou juste que pour les moi vous un texte vous dit Marie Senat, I want to be on your class. I want to be the first batch. So l'école là ouvert, m'a contacté mon ligne by ligne, job of nursing dit on faire là. So, tag yon moun nou konen ki fini nursing ki pa ka pase, tag yon moun nou konen nan moment la ki ke problem, que board of nursing ka pe an zo ki tag moun sa mwen, s'il vous plaît. Un téléphone, dis moun de l'autre téléphone moun ya brele a kap monte kon sa moun ap kon sa. So, pa bliye que ou même ki ta reme pase board of nursing examen ou aline examen plusieurs fois, ça va marcher. Cléant, c'est The Key to Enclec Success by Marie-France Senat, 631 708 21 21. OK? OK, so, il y a un monde qui te pose mon question aujourd'hui, moi choisi de répondre. Sur live. OK, so, premier bagay nous supposé connaître nous dans l'école nursing. Tag yon moun qui dans l'école nursing, yon CNA, yon LPN, yon RN, yon moun qui dans domaine healthcare, yon tag li, parce que ça très important pour lui, yon moun qui sont en Haïti, qui t'a remis passer board of nursing dans tag li pour moi. So, examen nursing dans chaque jour, nous ça review la kay pam c'est clé ou pas capable passer, li facile. Premier bagay ou supposé connaître qui côté board of nursing mette patient. Est-ce que dans question board of nursing dit qui côté patient, y ou mos connaît est-ce que patient la kay li? Est-ce que patient fait entrer dans emergency room nan? Est-ce que li admit? Est-ce que dans ICU? Est-ce que patient ça pour stop? You need to know that. Parce que l'on connaît qui côté patient et qui côté patient sorti, qui côté patient bralé, Berlin cher pour moi, s'il vous plaît, qui côté patient sorti, qui côté li bralé, faut connaître tout ça. Exemple, the board of nursing dit comme ça que Mr. John, 79 years old, recently discharged home, previously was admitting with high blood pressure, recently discharged home. And Mr. John, after being home for 3 days, came back to the hospital with hypertension crisis. So, share live la ti moun, parce get ti moun ki l'école, get ti moun ki nan nursing, get ti moun ki gen intention pour nursing, get famille ki nan nursing, gen famille nou ki envie become a nurse, share live la, m'pa bretan pil. So, premier bagay ou supposé demander, as your nurse, Board of Nursing do, Mr. John is 79 years old. You want to know why que Board of Nursing bo l'âge moun? That's your first question, why? He could tell you Mr. John was previously discharged with high blood pressure and was sent home on medications. Li te ka djou li kon sa, why li do Mr. John 79 years old? Le Board of Nursing bo l'âge moun nan, c'est yon bell que li rang. He pulled the bell. So now, if Mr. John te discharged avec high blood pressure, he come back 3 days later with high blood pressure crisis, he's 79 years old. Now you need to know why. Premier bagay wap fè as a nurse, you need to assess his visions. Est-ce que Mr. John able to read the label of the medications? Est-ce que Mr. John able to understand? Est-ce que Mr. John could read? Est-ce que Mr. John need an eye check? Est-ce que Mr. John need new glasses? Because love est passé à la caille, tout bagay sa comes into play. Est-ce que li ka li, est-ce que li ka ouais pour pull 50 mg of metoprolol or 0.5 mg of Norvax? Est-ce que ouais? Est-ce que Mr. John ouais? Est-ce que Mr. John know how to read? Or est-ce que Mr. John gen enough kob nan mel pour l'acheter médicament? Est-ce que comment il est ça assurance ti couvrir médicament? Tout bagay sa ou it comes into play. Like I said to you guys, the Board of Nursing exam is so easy, it's like a piece of cake. But faut ka comprendre ni understand it. Communauté a gon seul problème là-dedans. Communauté a selfish, communauté a pas payé de l'autre monde qui pas konon bagay, communauté pas involve non série de bagay pour éducationnellement. Communauté a c'est plus un paquet de monde barbare, moun sort, moun qui sorti en Haïti pas kon côté ou vle rive dans communauté. Non, c'est bien dommage, it's a reality, it's the facts. So I'm so sorry to say that, but it's reality. Le Board of Nursing a pas l'avant de location. Li do, Mr. John is admitted. Bli about ear, bli about triage, li admit. Ça veut dire passer ça qui get admit dans l'hôpital là, li get passer dans triage, li get passer dans emergency room. Nah, it's done. Parce que li get passer dans zone za. Is it a direct admissions? If it's a direct admissions, so nous pas besoin ER, nous pas besoin triage. So when a patient is already admitted, if they said Mr. John is admitted 2 days post admissions, that means nous pas going to worry about first care in the ER. We need to worry about what medication they're prescribing on the floor now. You need to, to follow the care of the patient on the floor. So let's say you go 18, you do ça que depuis vous mettez, you ba mette Mr. or Mrs. ou mette qu'on y en a parlé de teenager ou petit bébé. When you do ça que Julian is 18 years old, Julian came into the hospital with his mother, complained his asthma exacerbations. So guess what? Now, if they're looking for nursing assessment, they are looking for your input as a nurse. Nursing assessment, Julian is only 18 years old. He came into the ED with his mom, asthma exacerbations. Nursing assessment, they're looking now. So now, pour qui ça bon l'âge Julian is only 18 years old. So what teenager does? Teenager, busy, avec zami, yo busy dans téléphone à bradoter, yo busy à jouer football, yo busy, yo pas manger, yo oublié boire de l'eau. Asthma patient need to be well hydrated. So most of the time the teenager have asthma exacerbation because they fail to drink water. Gade l'âge moun nan, gade kote ou di yo jwen ni kote li. So, if you have a teenager coming to the hospital with asthma exacerbations, you got to look to see where this teenager is at in the hospital. Remember, the hospital have their packet ban volel. There's emergency room, there's medicine admission, there's ICU, there's surgical ICU, there's psycho, there's maternity, there's med surg, there's CCU. You need to know exactly where your patient is at. If your patient's it's post-op, guess what? You need to know the patient age, how many days of post-op. Let's say, they tell you Mr. Joseph is 2 days post-op, admitted on the 3rd floor in ICU, or transmitting to regular floor now, because usually you 2 days in ICU, that's it, unless this, situation is complicated. So now, my patient is a post-op patient. My patient's only 2 days post-op. My patient is on a regular floor. 2 days post-op. Now I need to use my critical thinking. If my LPN or my CNA come to me and said, you know what, Mr. Joseph has a fever. So I need to use my brain now. I need to use my intellect. I need to use my professional proficiency to find out exactly why my patient is having a fever. Remember, post-op, the first day, 24 to 72 hours, I'm not worried about fever. Am I going to report it to the doctor? Yes. Am I expecting the doctor to do anything? No. I'm expecting the doctor to say, give the patient toutlemonde. Because, the body is trying to, the body is fighting, the body is searching for its equilibrium. Because the cells, everything, operation, you coupe core, cells you have tried to migrate again, cells you have tried to find their place again. So I am going to be concerned. Single patient after 3 days, 72 hours, the patient develop a fever. The patient is a post-op patient. Now I'm concerned. That means the patient develop an infection somewhere. Now I need to be concerned. Remember, for you to answer questions on the state board, you need to know your patient locations, the patient age, how many days the patient been in the hospital, where the patient located. If they tell me the patient is in the community, it's totally different. And the community, remember, I only have my 2 hands. And I could only do miracle with my hands. Because I'm not a first responder. I don't have any oxygen. I'm not able to intubate a patient on the field. If I'm a nurse practitioner, of course I could intubate. But if I'm on the field, I don't have those vitals, the vitals instruments with me. Let me tell you what we're going to do. Let's say I'm walking on the street. I'm in the mall and suddenly I see a child collapse. I'm going to run to the child because I'm a provider. I'm going to run to the child because I have knowledge in nursing. But the only thing I can do, I'm not going to lay that child flat. I'm going to make sure I'm going to lay that child against the wall. Or either, if the patient the child loses consciousness or the patients, I'm going to start CPR if there's no pulse. And I'm going to indicate somebody else to call 911. Because I only have my 2 hands. I have nothing else. So the exam is so easy. Examen facile. C'est parce que either nous à l'école nous pas learn or nous pas prendre sans nous pour nous étudier. C'est ça me fait. Moi provide a good review. I explain to you the process and I teach you the disease. And guess what? Si pas comprendre disease yo, wow, ou pas à l'école ou pas d'étudier yo, it's a different ball game. You have to study a lot. So let's say, pas oublier, c'est ça fait me dire nous faut nous connait qui côté nous yé. Si nous la rue, m'pa gagner nan même. I'm rely on my two hands to save a patient in my mouth. At one point, if I have to do CPR and I don't have a piece to put in my mouth, I'm going to use my hand as a cuff to administer breath to the patients. There's a question like this on the board. I'm going to put my hands as a cup and I'm going to have no choice to administer breath with the patient until EMS come. So, the most important part for you is to understand your disease